Hello everyone. Welcome to today's presentation. I'm excited to have you here as we explore Prometric MCQ and exam preparation. On this first slide, we're setting the stage for what's to come. I'll give you a quick overview of the key points we'll cover today. We'll discuss effective strategies for preparing for Prometric exams and how to approach multiple choice questions with confidence. So, let's get started and make this session both informative and engaging. Let's take a closer look at the normal respiratory rate for adults. When we talk about respiratory rate, we're referring to how many breaths a person takes in a minute. This is a vital sign, and it helps us assess overall health. For a healthy adult, the normal respiratory rate generally falls between 12 and 20 breaths per minute. It's important to remember that this range can vary slightly depending on factors like activity level, age, or even emotional state. For example, someone who's anxious or has just finished exercising might breathe a bit faster. But in a resting state, staying within that 12 to 20 breaths per minute range is considered normal. Understanding this helps us recognize when someone's breathing might be abnormal, which could indicate underlying health issues. So, keeping an eye on respiratory rate is a simple yet crucial part of patient assessment, tying into the overall theme of monitoring vital signs effectively. The normal respiratory rate for adults typically falls within the range of 12 to 20 breaths per minute. This is an important vital sign because it gives us insight into a person's overall respiratory health and can help us identify if there's any underlying issue. Rates that are significantly above or below this range might indicate respiratory distress or other health concerns. So, remembering that a normal adult respiratory rate is around 12 to 20 is key for proper assessment and monitoring. Let's go over the normal respiratory rate for a healthy adult at rest. Typically, it falls between 12 and 20 breaths per minute. This range is considered normal and indicates that the person's breathing is functioning properly. If you observe rates above 20 breaths per minute, that's called tachypnea. It's often associated with conditions like fever, anxiety, pain, or respiratory disorders, things that cause the body to breathe faster than normal. On the other hand, if the rate drops below 12 breaths per minute, it's known as bradypnea. This can happen due to medications such as opioids, neurological issues, or metabolic disorders that slow down breathing. So, putting it all together, the correct and clinically accepted normal range for respiratory rate in adults at rest is 12 to 20 breaths per minute. That's why option B is the right answer. It's important to remember this range as a baseline when assessing a patient's respiratory health.